So, so welcome everyone to the week one technical session. I hope all of you who have joined today, you have been able to create your accounts on the Hive platform and have been able to start the course. I don't see many responses on some of the initial discussions. So it will be great if you can start going through them so that you go through the materials. Although I saw that there are a lot of people who have finished the competency assessments. Some of you may have received your reports today, while others may be still under analysis and preparation, and they will be sent out very soon. Today's session it links to the first couple of modules, which are about how health system is organized, and then how supply chains are organized in countries, and more specifically in Zimbabwe. So let's quickly get into it. But before that, a quick poll on how you are feeling. We do these mood checks every session so that we know how you are feeling, because we also think that depending on your mood, you may interact more or less. So I hope everyone is feeling amazing, or at least good, and you are ready to engage with your fellow participants and myself. And I don't know if Wilson is here. Wilson? Okay, I don't see him. Um, so that we can engage in good discussions throughout today's session. Priyanka, please show when it is ready. But let me move on to the next slide. Okay, so 50% they're saying they are good. 36% are just okay. So I hope those 36% your mood becomes better by the end of this session. That would be my target. So let me smile more, and let me try to engage more with you so that your mood improves. Okay, so what's happening this week? This is the first week of the course. We have two modules: introduction to health system, introduction to health supply chain. Then we have a few. Then we have a few discussions. Some are called voice your opinions, while there are others which are either are we on the same boat, or I think there is one which is about root cause analysis. So those discussions are there for us to engage with each other and find some key issues and solutions with respect to Zimbabwe's supply chain. Then under case studies and assignments, there are two case studies, one for the Tanzania supply chain, and which is more oriented towards public sector. Then there is a case study on score model, which is although I don't want to call it a private sector concept, but it is applied more in private sector than in the public sector. So what we want you to do is review the score model, and then apply that either in your country or in your organization, and see how it will work. So we will discuss more on those discussions. I will be there looking at your responses and talking to you directly on the platform. At the end of module 2, there is an assignment which talks about creating the flow of products, money, and information. And we will discuss more about that today. So moving on, Priyanka, do I have access to? Uh, okay, I have. All right.
Yeah.
Yeah. So like I was saying, there is a competency assessment which several participants have already gone through. If you have not completed this, there is also a link on this slide, but it is also there in the introduction module. So please finish this, because it will tell you the key areas where you need more learning and application, so that you can focus more on those supply chain areas than the others. Okay. Now, a quick discussion. I hope you are ready. This is also part of the program on the platform, but I want to hear from you. Uh, uh, the other day, I heard that there are several pharmacists, there are several pharmacy technicians in the group, and then there are a couple of other type of cadres as well from an educational perspective. I think there were some management people, and then some others as well. So based on where you are working, or your education background, how do you contribute to health system? Now if you ask me, for example, so I work with different countries. I work with supply chain organizations. I work with donors. I work with UN agencies. But the way I work is, I help them towards policy development. I help them with guidelines and SOPs, which eventually is reflected in the supply chain processes that eventually leads to optimization of supply chain, so that the consumer or the patient, they receive the intended product. So that is how I contribute to health system, in my work. Now the question goes back to you, and please, you can unmute yourself and speak, or you can also write your response in the chat, as to how do you think you contribute to health system. So I will just pause for a moment, and please, this is an interactive session, so I would request you to unmute yourself and speak. You can also raise your hand if you want. So over to you. Yes, maybe between Faith and Matero, whoever wants to speak.
Good afternoon. Yes, I work in a provincial pharmaceutical pharmacy stores for the city of Bulawayo. I assist facilities to order drugs from the pool system, using the pool system from the provincial stores, from the regional stores. And also I distribute commodities to our facilities. Basically, that's what we do.
So eventually you help the patient. You are in direct contact with the patients, or the other stakeholders, and you make a direct impact into the lives of people in your in your location, right? And since you said you're also working with regional warehouses, so you also contribute to the health system by coordinating with them, because they are also part of the health system. So you need to understand your role within this overall big health system. So great, thank you so much. Aquilin, please, you may speak.
Good afternoon, guys. I hope you're all doing okay. So basically, my job involves dealing closely also with patients. I interpret prescriptions that come from doctors, hospitals, clinics, whatever it is, and then I then give them the desired medication. And also, I do as a community pharmacist, I do also patient counseling, education. People come, they explain to me what they're feeling. I educate them on the do's and don'ts on how to remain being healthy or being healthy. For example, a mother can come in with a baby who is not feeling okay, feverish and stuff. I then educate them, how to handle babies, the best thing that they can do, be it nutrition and other supplementary things that are needed. And then the patient walks out happy because I've educated them. And also, some of our other things that I'm also involved in, make sure it's also like protecting the medication, so that ensuring that people are not abusing medication. So I don't just give anyone any medication that they need. I have to make sure that they have a document that is requiring that specific medication. So basically, in a nutshell, that's me.
Quick question: are you also involved in reporting data in any system?
Yes, say for example, a certain medication that comes into Zimbabwe,
Mhm.
called these adverse effects. I'm responsible to record that those adverse effects and then report them to what we call the Medical Control
Yeah,
Authority of Zimbabwe,
yeah,
MCAZ, which is
yeah, yeah.
which is the one that oversees the overall things to do with medication within Zimbabwe.
Mm. So you see, your role, it connects to various components of health system. So on one side, where you are directly, coordinating with consumers and patients and counseling them and giving them medications based on the prescriptions. On the other side, you are also making sure that those supplies or products are available in your pharmacy, while you're also reporting pharmacovigilance data to higher authorities to understand the safety and efficacy of any product. So you see, your role is multifaceted within a health system. Yeah. So that's great to know from you. And maybe we go back to Metero and Faith, and then there are some points on the chat which I will read.
Good afternoon. So for me, I just want to add from what Mrs. Mtero has said, because we work together. We also distribute vaccines to our private and the public sector. And we also assist them with, let's say maybe their cold chain on how they are supposed to maintain their cold chain in case there are any challenges that they are facing. So basically that is what we do. And we are not in direct contact with patients.
Oh, okay. All right. So you are in contact with other facilities who are eventually dispensing the product, but still there is an indirect touch point with the patient, I would say. Excellent. Let me read a few inputs in the chat. One from Lynette. She works in a warehouse and her role is in distribution of pharmaceuticals to institutes, pharmacies, as per demand requests. So you see, Lynette, in the health system, your work is regarding the supply of products, which is a very key component of health system, and you will also read about that in the course as well. Madzinga says he's I'm not sure if it's a he or she, I'm sorry. So they are a pharmacy technician at a prison complex responsible for ordering of medicines, inventory management of those medicines, and dispensing and counseling. So again, as a pharmacy and pharmacy technician, your role is in a health system is linked directly with the management of patients, and of course all the products that you are dispensing as well. Shuvai says, I'm a systems compliance and GSTP manager at Back Logistics. I contribute to the health system by ensuring good storage and distribution practice requirements and guidelines are adhered to. So again, it's also linked with processes and systems. So the reason why I wanted you to reflect onto this question is because health system is a big, um, it's a big network. It has hospitals, health centers, organizations who are procuring, distributing, organizations who are creating policies, wholesalers, distributors, manufacturers, labs. Then it also comprises of the products themselves, their procurement, their storage, the distribution. There's so many things, and each of you are somehow eventually your goal is to improve the health status of the country that you are in, by whichever means that, like, someone is in warehouse, someone is also managing pharmacovigilance systems, someone is directly coordinating with patients, also managing supplies, So the different functions in a health system. And if we go much more deeper, we will see that eventually all of you are somehow doing some part of supply chain function as well. So if when we saw all these responses, you have a touch point for supply chain systems as well, where either you are managing inventories, you are dispensing, you are reporting data, or you are managing good storage and distribution practices, which is a key part of supply chain. So what I wanted you to reflect on is how you fit into this system, and how you are a key cog in the overall supply chain system in your country. Yeah. It's good to read all these responses coming on chat, but since we have to cover few more things, you can also chat with each other if need be. But let me move on to the next slide. Now, today we are going to discuss how supply chains are governed at a country level. There are a few concepts which I will talk about, then we'll ask questions from you like this, exactly like this. There are some discussions in plenary, and then at the end, there will be a breakout group. So what we will do is we'll put you in 2 or 3 groups. You already should have the Word document which was sent to you. Priyanka, maybe also upload the Word document in the chat window as well. So if someone they don't have the Word already from their emails, they can directly open it from the chat itself. So we will put you in groups. The document will be with you. You can discuss. Since all of you are from Zimbabwe, you can discuss and go through those questions together. And I would want okay, just a sec. I would want to see responses from both sides, public sector and private sector as well, and then we can discuss if they're similar or there are some differences within them. Yeah. So quickly starting this discussion, first of all, when we talk about governance, we try to understand the overall structure of the health system and the overall structure of the supply chain system in a way whether they are centralized or they are decentralized. Now, centralized systems are managed by a central authority, like a federal government or a federal organization. And the key point is that the decisions are taken at one level. So all the various decisions which are needed for a health system or a supply chain, they are taken at one single level, let's say at a federal level. And then everyone who's part of the system, they have to comply with those policies and decisions which are taken at a national level or a federal level. In comparison, in a decentralized systems, uh, major policies are probably developed nationally, but then all the decisions for operations, they are delegated to a lower level. Let's say a state or a county or a province, they take their own decisions with respect to the guidance which they receive from the federal level. So if I give you a quick example, in a federal system, if a decision has to be taken, like how many warehouses should there be in a country or a region, that decision will have to be taken at a federal level. In a decentralized system, that decision can be directly taken by the minister or the governor of that province or state. They need not go to the federal level because they already have their own system, their own funding, their own structure and processes. They can take that decision at that level itself. If we look at health or supply systems, if you see the blue boxes, in a centralized systems, the policies, the budgeting, the procurement, the warehousing, distribution, all those decisions are guided by the federal government, and they are uh, passed down to the state or province or even the hospitals and health facilities. Similarly, on the other side, in a decentralized system, you see there are multiple arrows. The health policies, budgeting can be done at the federal level, but they can also be done at a state level and then passed down from both sides to a hospital or a health facility, on how to manage supply chains. So if you see the continuum, on the extreme left, we have a complete centralized system where there is only one authority who's taking all the decision and passing it down to the other levels. While on the extreme right, we have a fully decentralized system where the where full delegation is there, and the authority is of that state or province to manage their own supply chains. However, in many countries, we see a system which is a mix of both. So that's why we have put a smaller circle in the center, which is mixed. You will see certain things run from a federal level while others being run at a province or a state level. So that is a mixed system. Okay, so we need to understand this very carefully before we try to understand supply chain of our countries, for example, in Zimbabwe, because supply chain network and decision making, it is it is also guided by how that system is. So on that note, I think we have a poll to understand the how the health system is organized in Zimbabwe. Is it totally centralized? Is it totally decentralized? Or is it a mixed system? And what I want to see, if all of you have the same opinion. So I think the poll has been launched. So I look forward to the result. And we have a very interesting result on your screen. Just a second, I'm just trying to send you something. Yeah, so as you see, even in this group, now everyone is from the same country, but your understanding of how the health system is in Zimbabwe is different from each other. Now 50%, which is majority, are saying it's mixed, meaning that some decisions are taken at federal or central level, while there are several which can be taken and operated at a provincial regional level, right? The 38% who are saying it's totally centralized, while there are still some 13% who are saying it's decentralized. So you see, the reason why I'm trying to show this is because it is a very confusing topic. It's not very simple to understand. So let me invite someone who's saying it is mixed. And why do you say that? Because we need to clarify this as part of this group, whether it is mixed, is it totally centralized, or it is totally decentralized. So someone who's voted for mixed, please, if you can unmute yourself and tell us why you think it is mixed.
Hello?
Yeah, Blessing, please go on.
Yeah, the problem that I'm seeing is people work from different organizations. So some people in their organizations is mixed, and some people or in their organizations they rely on centralized situation, or and some others they do this decentralized one. But what I understand is it's very much mixed. Some decisions come from the federal government straight, and some decisions are being made in the provinces. It's not strictly one scenario. So, but when you're working in a situation where the situation is centralized, you think everything's centralized. And when you're working in a situation where things are decentralized, maybe taken down to provinces, you think that everything's decentralized. But what I understand is some decisions come from the federal government, And it's true. Some decisions, especially when it comes to health, some decisions come from the central government. The Minister of Health is a former soldier. He commands some decisions from the central government. In some decisions on supply chains of medicines is done at provincial level. At the moment, the country is building some pharmaceuticals, some pharmacies in every provinces, and all decisions are going to be made from those provinces. So that's why I'm saying it's mixed bags. If someone works in a mixed situation, he thinks everything's. If someone works in a decentralized situation, they think everything's decentralized. But if someone works in a centralized situation, they think everything is centralized. Maybe it's an issue of exposure now. It's only an issue of exposure.
Indeed. Let me go to Lloyd. Lloyd, you want to explain? So please, if you can unmute yourself.
Thank you. So I do concur with the previous speaker. If we look at the centralized, yes. So if we look at the board system, we are looking at health policies, we are looking at budgeting, we are looking at procurement, we are looking at warehousing, as well as distribution. So sometimes, probably, in terms of health policies, these might be governed direct from central level, and no one else can change that policy. However, when it comes to the budget or procurement of the product, this would depend on different organizations. Government might have its own share of the budget, but we've got gaps within the procurement system in terms of procuring products. Hence, other partners can come in and they've got a say in the procurement. Also in the warehousing, government is not providing warehousing to all stakeholders. Hence, we have got a mixed type of system where we've got government, partners, and other stakeholders coming in. And each one has got a fair share of say in how these things might manage. Thank you.
Yeah. Both of you have touched upon excellent points, and I totally concur with you that when someone is working in a centralized system, they feel everything is centralized. Vis-a-vis someone working in a decentralized system, their thought process work in that sense. Now, this question is also relevant for all the learners who represent private sector like Bach Logistics or some others. Reason being, and you might have seen this in the course in the beginning, where we say that a public health supply chain is as a network is very complex than a private supply chain. One of the reason being this matrix of accountabilities, whether it is centralized or decentralized. For a private organization, let's say we take an example of Bach Logistics, which is a global organization, not just an organization based in Zimbabwe, but it's a global organization. Now, maybe someone from Bach Logistics can discuss and tell us whether decisions, what kind of decisions are made in Zimbabwe versus what kind of decisions are made in their global headquarters, which everyone in Zimbabwe will have to also comply with. So then we can also say whether the operations of Bach Logistics in Zimbabwe works on a centralized accountability matrix, which is like every decision is made somewhere else, from the global headquarters, or it is a mixed system where some decisions are made in the global headquarters versus others, more contextualized needs, they are decided at a country level. So if someone from Bach Logistics can comment on this. No one? Okay, we'll have to ask that question again later. But I hope you have understood why I have been asking this question, and I think if we take a bird's eye view of Zimbabwe, we can say that it has a mixed accountability structure or a governance structure with respect to health system and supply chain, with major guidances and decisions are made through the Ministry of Health, and then different regions or provinces, they also have a certain level of authority on certain supply chain decisions at their level as well. So it's a mixed system. I think if everyone agrees, then we can move with that understanding of how is the health system and supply chain organized in Zimbabwe. So why we are asking this question? You can ask, okay, why? What's the need of understanding whether it's a centralized system or it is a decentralized system? Because there are two key issues that we need to answer for any supply chain governance. When we talk about governance, there are two issues that we need to talk about. One is accountability, and the second is responsibility. Uh, with accountability, we mean someone who is accountable, or who's the last uh, person that the buck stops or the ball stops eventually. For example, if we're talking about a Ministry of Health, then the final decision for anything has to be made by the minister himself, or maybe if there is a permanent secretary or a senior officer who works with the minister, who signs off on everything, that person is accountable. So in the case of supply chain in Zimbabwe, who is the accountable body? So if something goes wrong, so for example, recently, all of you must have heard the news that in Gambia, several children died by consuming a cough syrup which came from India. So the question begs, who was accountable in that case? And no one responded to that question, because those accountability metrics, those governance systems were kind of in the gray in that country. So here in Zimbabwe, if we have to ask for supply chain, which organization is accountable, what would be your response? If you have a response, then please put it in the chat. The second part of the equation is responsibility. Who is the organization or stakeholders who are actually doing the job day in and day out? So for example, I mean, I'm just giving you an example. I'm still not fully sure of how everything works in Zimbabwe. Over the period of this course, I'll get more idea. So Nat Farm procures a lot of products and they distribute them in the country. Now, which leads me to believe that part of the responsibility of public health supply chain is under NatFarm. Then there are different facilities and hospitals under each province who may also be responsible for buying and dispensing their products, or buying it directly from NatFarm as well. So part of that responsibility is also with them. you know so responsibility is, who are the organizations or stakeholders who are actually doing the job, versus who is accountable if something goes wrong, or who is signing off on all these systems that are being put in place in the country or in an organization. And same goes for the private sector. For private sector, it is much easier, because for example, we have a lot of learners from an organization called Greenwood Wholesalers. Now say it's a private entity. There are very small and clear lines of communication, in a sense that they would have a board of directors, they would have a CEO, they would have a couple more senior officials who are taking the decisions, like who are the accountable people going up to the board. And then all the staff members in different hierarchies and different positions, they are doing the job. They are responsible for their own vertical of whatever function that they are doing. It's much simpler, because their supply chain process, now if you go down in this graph, their supply chain processes are guided by their own organization. Their organizational processes, by which I mean human resource management, financial management, data management, all those things, they are also guided by their own organization. They don't have to look outside to someone. And management of stakeholders is also by themselves, and being a private entity gives them a lot of freedom in managing them as well. Versus in a public system where supply chain processes, like we discussed, it's a mixed system. Some of the guidance is coming from a federal system versus some guidance may be coming from a provincial system. Some actions are taken at a federal system, some actions are taken at a provincial system. In terms of human resources, in terms of data management, in terms of quality assurance, there are multiple stakeholders involved. It's not that simple. Your salaries are coming from a different fund, products are coming from a different fund. So financial management is also very complicated. And the way you manage stakeholders in a public system is also very different, because in a lot of scenarios, donors are quite, I don't want to use the term powerful, but I would say they have a lot of influence on how supply chain is run for the product that they are funding for example. So the management of stakeholders is also very difficult or different in a public sector environment. So that's why it is important to understand who is the central stakeholder, who is accountable, who are the ones who are responsible, and how are they influencing on these three issues: supply chain processes from quantification to dispensing, organizational processes, human resources, financial management, data management, quality management, all those organizational processes, how are those managed, and then how are you managing the stakeholders. And this is why this entire discussion of governance, centralized systems, decentralized systems, accountability, responsibility is important, because eventually when we go towards supply chain functions, you will say that, okay, but this is not in my control. So then how can I act upon it? And this we hear a lot of times in many countries, that, oh, this is not in my control. But as we go to the other side of the spectrum, which is a private sector organization, everything is within their sphere of control because they manage their own system. Yeah. So in that sense, both the systems are slightly different. Now I see several chats saying that the Minister of Health, the permanent secretary, they are the ones who are accountable. Someone says MCAZ is accountable. So yeah, so at a high level, these organizations and their leaders are accountable. They are accountable for creating the policies and the high level decisions on how the structure should be. And then the responsibility is passed down towards the mid-level officials and at a provincial or a regional level, who actually take the actions in distributing supplies uh, to the health facility and eventually to the consumer or the patient. Yeah. So you understand what accountability and responsibility and how they influence these issues in a supply chain. Now, there's something. Okay, so there is a small discussion which I want to have here. I have three questions. Who governs health supply chain in Zimbabwe? Now, part of the answer we've already received. It's from the office of the Minister of Health, uh, and then MCAZ, and there may be a couple of other stakeholders. What are the key policies for public and private sector alike? Can you name some policies which are similar for both public and private sector? And then number three, who manages public supply chain in public sector, or who manages health supply chain in public sector? The responsibility. So first is the accountability part. The third question is who's responsible, who's actually doing it. maybe we can discuss function by function, maybe because it may change at a federal level and at a state or provincial level. And then the second question is, what are some policies which are same for both public and private sector, if there are any? So I'm giving you a few minutes to think. We're not going to spend too much time on this, but if someone wants to speak, you can unmute and speak. If someone wants to put some responses in the chat, then I will read them out. So maybe we'll spend about 5 minutes on this, and then we will move ahead in the same line of thought with flow of products and money and information. So yeah, so back to you. Anyone would like to speak on any of the questions? Not necessarily you have to answer all three. You can take any one of the questions as well. No one?
I'll take the last question there.
Yes.
Health supply chain public sector. So basically, we have got a NatFarm, National Procurement Distributor for the Ministry of Health. Then it does distribute to every public health facility where responsibility is given to the district pharmacy managers. And this is further distributed to the service delivery point, where a trained cadre, most probably, who could be a nurse or someone who then manages the stock at their facility. So it's not from to district to the service delivery point. Someone can test what I have.
And those service delivery points are not managed by NatFarm. They are directly under the Ministry of Health, right?
Yes, they are directly under the Ministry of Health. So whenever a nurse or a district pharmacy manager is managing, they are managing the stock on behalf of the permanent secretary, who's the accounting office.
Okay. Blessing, you also wanted to speak, and then I will summarize.
Yes, I just want to take the second question, just briefly.
Okay.
I think both the private and the public sector, they do adhere to safety and security of the medicines. I don't think they compromise on that, because the medicines do require a certain level of security and certain level of safety, so that maybe they're not stolen, or maybe they don't go bad whilst during the supply chains. So I think both public and private, they do adhere to those policies.
Excellent. I really value that you actually talked about that. If there is no one else who wants to speak, then I will summarize these 2 points, because they're very important points. Please, if someone else wants to speak, you can unmute. Okay, if you want to speak while I'm talking, then you can raise your hand. But Blessing, you talked about a very key policy, which is about medicine quality and safety. I think that is same across public and private sector. And within that, if we talk about supply chain, then we have the good storage and distribution practices, which in Zimbabwe's case, there is also a guideline from MCAZ as to how pharmaceutical products should be stored and distributed along the supply chain, which is possibly same for public sector and private sector. So that is one policy, I would say, or one guideline which is same. Also, I would like all of you to check if there is a national medicine policy or a drug policy in your country. If there is one, then that should apply to both public and private sector. So please check if you have such a policy, national drug policy or a national medicine policy. It may be a standalone policy, or it may be part of a national health policy as well. But please do check. If you know that it exists, then just put it in the chat. If you don't know, then please check, and then we can discuss it in a discussion on the platform or in the next session. What Lloyd mentioned, which is very important to summarize, if you see the overall supply chain, which starts from selecting the products and ends at dispensing the products, in case of public sector in Zimbabwe, there are two bodies who are working side by side. One is the structure which is managed by the Ministry of Health, where you have all the hospitals and health facilities, while there's another structure which is although part of Ministry of Health, but it's still separate in terms of its operations, which is Nat Farm. Now, Nat Farm does not have any um, uh, authority over the hospitals or the service delivery points. It is still Ministry of Health. So whenever Nat Farm has to receive data, or Nat Farm is doing quantification, or Nat Farm is trying to optimize their supply chain, they are very much dependent on the Ministry of Health through their network of health facilities and hospitals. So there is a mixed responsibility in this case with respect to supply chain, because part of it is happening with one organization and the next part is being managed by those entities which are managed by a different organization. National drug policy is available. Both private and public sector make application to MCAS for importation of medicine. Exactly. So that's from the perspective of registration and regulatory. So regulatory systems are also same for both public and private sector. So excellent. I'm very happy that you're going in the right direction. This is exactly what I wanted to discuss with all of you. So in terms of who governs health supply chain, it is the Ministry of Health for both public and private sector alike. There are certain policies which we talked about, drug policies, registration guidelines, which are same for both public and private sector. But in terms of public sector, it is a coordination between NatFarm, which is also part of Ministry of Health, but a separate body who procures and distributes up to a certain level. And then it's the responsibility of those service delivery points to manage their own stock and dispense the product and then request for more stock and also provide data, right? So there has to be some coordination there. And that is where our public systems become more complex. I mean, if we take an example of a private system, again, if someone from Greenwood Wholesaler is here, you can comment on how you collect data from the beneficiaries to whom you supply the products. What is the uh, structure or the relationship there? How easily do you get data which informs your system? So if someone from Greenwood is here today, I would request them to comment on that, because that's also part of the same equation of governance. But otherwise, I will quickly move on to the next section. But in case you have any questions, please raise them in the chat and I will answer them as we go along. So if you see the text in red, I will read that out. And this is for public sector only, unfortunately. Supply chain operations, they depend on how public sector organization is governed. Now, in this case, like we were discussing, Ministry of Health is the umbrella organization under which on one side you have NatFarm, on the other side you have network of hospitals and facilities where the products are being eventually stored and dispensed. So these two entities must speak with each other if supply chain has to be efficiently managed. Okay, so what influences governance? We talked about the centralized or decentralized structure, the legal structures between the central medical stores, which in this case is NatFarm, and the sub-national authorities or the ministry and the health facilities and hospitals. what is the relationship there? That relationship is very important, because if the health facilities, hospitals, your provincial government, they don't have a good relationship, or if they don't have a mandate of getting supplies from Nat Farm, then there will be a disconnect at some level. you know Number 3 is policies on human resource management, sorry, financial management and procurement, public procurement. What are those policies and how they are managed? That is also a part of governance. Presence of donor ecosystem. And I know in Zimbabwe, there is a large presence of donor ecosystem, and that also influences governance of supply chain in the country. And finally, prevalence of private commercial sector. Now, in case of Zimbabwe, although we don't have pharmaceutical manufacturers, but we do have several wholesalers and we have logistics providers. So, for example, Bark Logistics is one of them. In terms of wholesalers, we have one entity present here with us, which is Greenwood Wholesalers. So, their presence also influences how supply chain is governed. And I'll give you a quick example. If the network of wholesalers and importers are not strong in a country, like there are several countries which are in conflict, they rely on large procurement agencies who buy in bulk from different countries, and then they ship everything into the country, and they store it as well sometimes. Versus if you have wholesalers and importers, then you can place your orders, or you can give contracts, procurement awards to your local wholesalers and importers, who then imports it for you and supplies you. And I'm sure this happens in Zimbabwe. And there's a third mechanism as well, where the procurement agency, which in this case is NatFarm, may directly be in touch with manufacturers outside of the country who are represented by some local representative, but the manufacturers are in direct contact with NatFarm. So it happens in some countries. It may happen in Zimbabwe. It may not happen in Zimbabwe, but in some countries it do happens. Okay, so this also affects how the supply chain policies are governed, what kind of inventory cycles are happening, in what time period procurement is happening. So those decisions are affected by all these. So Lloyd, you have raised your hand, so please you can talk.
Just to add that we do have a couple of pharma manufacturers in Zimbabwe. Maybe the biggest one being Varicare.
Yeah.
Yes, so we do have quite a few manufacturers.
Okay, yeah, sorry, I did not mean to say no manufacturers, but yes, I meant to say there are a few. So there's a limited number of manufacturers in the country. So only those products can be bought locally. For others, it has to be imported either directly by NatFarm, or NatFarm through a private wholesaler or importer. And similarly for private sector as well. If Greenwood Wholesaler, if they are purchasing locally versus how much they are importing, so that also something they can tell us if they are part of this session. Okay, so now we are going to do a small activity. There are 4 questions which is about governance as well. Although I'm thinking we can skip it, because we've discussed a lot of it today, like who manages procurement, finances, what is the relationship with health facilities, who's funding. So we've already discussed this, but maybe when you receive these slides, please fill this up and share the screenshot of what you filled, either on the WhatsApp group or on the Hive platform on any discussion. And we will maybe better would be a WhatsApp group, because I'm also wary of time. We have 1 hour left, and there is a big breakout session that we need to go to. So this one is just a comparison to understand what's happening between public and private sector. Eventually, what you will see is that for private supply chains, the governance lies directly with them. But for public supply chains, there are various organizations for governance. For example, in terms of funding, you have the government, you also have donors. So you also have to comply with donors. The relationship with health facilities is different because it's not directly under NatFarm, for example. The decision-making structure is decentralized or mixed, as we discussed, right? So all these things, just when you have the PowerPoints, uh, you can fill these up and you can share the pictures on the WhatsApp group, and then we will have a discussion there. Now, quickly moving to, yes, the flow of products, money, and information. And this is also linked to your assignments, because you have to draw out the flow of product for Zimbabwe. And I want to see how different it gets between amongst the learners who are part of the public system, and also between the learners who are part of the public system versus who are part of the private system. So I want to see the differences as well, and we will discuss that in the next session. But when we say flow of products, money, and information, what we want to say is how the products are moving from wherever they are being manufactured to the service delivery points. What are the various touch points, you know? And if you see the statement on the slide, governance of supply chain influences the flow of products, money, and information, which we have been discussing. So let's take a simple scenario where a supply chain organization controls everything, which means they have the authority. Okay. So they place the order to the supplier through a procurement cycle. The supplier ships the products, and the port control is managed by the same organization along with the supplier. And the products reach the central warehouse. From the central warehouse, it goes to multiple regional warehouses or provincial warehouses, from where eventually it is distributed to the service delivery points. Similarly, we'll discuss the information, how in a simple scenario, it can come directly from service delivery points directly to the supply chain organization. Because if there are centralized systems, if they are decentralized or if they are staggered, then from there, the information can go to regional warehouses where it is collated and then reported to a central warehouse of the supply chain organization. This is a very simple scenario versus a parallel system or a vertical system where there are different programs being managed by, let's say, various implementing partners, various donors who are making their own decisions on quantification, procurement, and hence, they are sending their own requests to the different suppliers who are distributing the products or exporting the products directly to different warehouses as well. So different program have different warehouse, but eventually the final step or the final consolidation may happen at a regional warehouse, or in some cases it may also not happen. So different from different warehouses, there is a vehicle which goes to the service delivery points, and for different programs different vehicles are sent to the service delivery points, which complicates the system to a large extent. But this is how a lot of vertical supply chain systems were organized in the past. Now, we can say that a lot of vertical systems have been abolished, and we see more integrated systems today, which look something like this, where there is a central warehouse and then products go from there. But there are still some countries where this is happening even today. Now, in this case, there is no central supply chain organization. Everything is happening from a program perspective, versus in this case, where there is a central supply chain organization. Now, this scenario corresponds more with what is happening in Zimbabwe, with some exceptions, like there are still some donors who are influencing to some extent. Uh, the number of regional warehouses, they may be different. Some products may directly go to some bigger hospitals or service delivery points, versus some products may be consolidated at a provincial level or district level, like you were saying. Yeah. So this one is more closer to what's happening in Zimbabwe. So for the private supply chains, now, first of all, I mean, I have throughout the session today, I have not heard from them, but I had created this slide specifically to understand how private supply chains are working. So I wanted to draw some arrows on how the product is coming from the manufacturer and where is it getting consolidated first? Is there only one point of consolidation, or is there a second point of consolidation at a provincial level? And then from where it is going to the service delivery points. So if someone from private sector, either Buck Logistics or Greenwood Wholesalers, Valerie is saying, are you sharing a slide? So Valerie, are you talking about this particular slide? If you're talking about this, I mean, someone just need to speak and then we can quickly draw it out on our side itself.
Oh, okay, because I wasn't so sure because there was nothing showing on the screen and yeah.
No, I mean, are you not able to see a screen?
Maybe it's my network, but I can't see anything.
Okay, no, I
can't
mean,
see a screen.
there is a slide on screen. Okay, that's unfortunate, but there is a slide on screen. Is it just with Valerie or is it happening with everyone? Can someone else just speak up?
We can see the slide.
Okay, okay,
We
all right.
can see the slides. I think
Okay.
Valerie was meaning, are you going to share the presentation after that?
The presentation has already been shared with everyone, I think. But if someone has not received it, once we share the recording, it will be shared again with that.
Oh, okay. My screen wasn't showing the slide, but it's now showing. Thank you very
Okay.
much.
All right.
I think it was a network problem.
Okay. All right. All right. So if someone from private sector would like to comment, then I can start to draw out the supply chain for any private sector organization. This will also help everyone else in the session. So let me just wait. Okay. I see someone. Priyanka, sorry, 1 second. Priyanka, can you just open slide sharing for more than one participant so that I can share my screen? Yeah, thank you. Okay, yes. So Priyanka, if you can stop share for a moment. And then Valerie, you started to speak, so please carry on.
It is vertical. Products flow from the manufacturer. Well, products flow from the manufacturer to the warehouse, and then these are distributed to the different facilities.
No, so what is the first point of consolidation? Consolidation must be happening somewhere, right? And also tell us which organization that you represent.
Oh, okay, I'm from Greenwood.
Okay, so for Greenwood, where are the products getting consolidated, or they are not consolidated, they are directly going to an intended place, for example? Because there are some private players where there is no consolidation happening.
Consolidation happens at the warehouse.
So how many warehouses do you have?
We've got, well, we have got 3 warehouses in different cities.
Okay. Okay.
And the main one is in the capital city.
Okay, Harare.
Harare, Bulawayo, and Masvingo.
I'm sorry if the spelling is wrong for the third one. Okay, so you have 3 warehouses and they are receiving products directly from manufacturers?
Some are from manufacturers, some will be from other distributors.
Okay, so there is a distributor in play as well. All right.
Yes.
So one arrow goes like this. One arrow goes like this. Now from these warehouses, the products are directly going to the facilities or pharmacies wherever they're needed, or is there any other point in between?
They go directly to the facilities that require, so it will be retail pharmacies or hospitals, clinics, etc.
Okay, so all of them, whether they are pharmacies, hospitals, or smaller pharmacies, everyone receive directly from the warehouse. Just reiterating the fact.
Yes.
Okay. So just for other learners in this session, now if you see here, there's only one point of consolidation happening at a warehouse which is in three different cities, and the reason there are three warehouses is to um, is is to reach the intended beneficiaries in that geographical location, because in terms of their network they may have realized that they cannot reach the warehouses which are in the Mashingo site from Harare, for example. So that's why they've created three. Am I correct, Valerie?
Yes, you're right.
Yeah. So this is their network or supply chain network looks like, which is, I mean, in this slide it looks very simple, although it's not. I mean, we can map it on we can put it on the map of Zimbabwe. So we will see three warehouses in three different locations. They have direct agreements with some manufacturers outside of the country or maybe within the country, if they are local manufacturers who are directly sending their supplies, or the supplies are coming first to those three warehouses, or they also have agreements with distributors from where the products are coming to these warehouses. Now, these warehouses are acting as two things. One as a storage point, and also the second thing we call it distribution center. So these warehouses are not just warehouses. There is a very dedicated uh, what's the right term? I'm just trying to figure it out. Inventory turnover cycle. So there's a very dedicated turnover cycle happening from each of those warehouses, and it's quite fast. The products may not stay there for too long because they keep on getting shipped to the intended hospital or pharmacy based on their demand. And of course, there must be a cadence of when they're getting shipped. I'm sure they're not getting shipped on a daily basis, but there may be a weekly or fortnightly structure, or in some cases, monthly structures, where depending on the demand, which is posted either on their ELMIS system or whatever system that they have, the products are shipped and those requests are fulfilled. So this is a system for a private supply chain. Now, if we go back to the public supply chain, we have one central warehouse. I don't know how many warehouses. Sorry, I don't know how many warehouses NatFarm has. So there may be a central warehouse in Harare, and there may be other warehouses in other locations. Um, so we also need to see how the product is moving from a supplier or an importer or a distributor to central warehouse. If everything is getting consolidated there and then moving to a different location. So that is how we look at flow of products. So thank you so much, Valerie, for this. Um, it's very helpful. I will create a much better diagram before we send out the slide, so that all of you also understand what we have been trying to talk about. Okay. Um, let me keep on sharing my slides. Now, in terms of the flow of money, the first thing to understand is who is paying for it. Is it the patient? Is it the government? Or is it the donor? In terms of private sector, it's very clear. The patients are paying for the product. Yeah. So there is a clear markup between the purchase price and the selling price, and that markup is running the entire organization. It is a very clear structure. For public sector, it is a bit complicated. Part of the money is coming from the donors, part of the money is coming from the government funds, maybe from the taxation pool or something else. And then I'm sure even in public sector in Zimbabwe, patients are paying for the products, although I'm not sure. And to answer that question, there is a poll on the next slide. And Priyanka, if you can launch the poll, where we try to understand who pays for the commodities in Zimbabwe. Please respond to the question as soon as possible. Okay, I think there's a unanimous decision where people are saying patients pay for the commodities except for the program drugs. Program drugs. There are some people who are saying there is also an insurance scheme, and the patient only pays for the insurance premium or insurance fee. So I think the insurance scheme is not very widespread. Uh, the majority of people who are saying that patient pay for them, except the program drugs, where it is fully funded from the donors. It is important to understand because as patients pay for the products, those that money is consolidated at both sides by the private sector as well and for the public sector as well. For private sector, it's a matter of profit. For public sector, it's a matter of reinvesting that money in buying the next cycle of products and then distributing it again back to the service delivery points. So the objectives are a bit different, right? So that is what we need to understand. And then we quickly move on to uh, information systems, how information is flowing. So there are three things we need to understand, or rather, what we need to understand is that there's a significant investment that has been made into ELMI systems. Someone can talk about on to how much extent that investment has been made in Zimbabwe, but data should flow in an inverse manner. So from service delivery points to either a regional warehouse or the central warehouse, and from that, a supply chain organization. If it is an ELMIS system, as soon as the data is reported on the system, everyone in the system can have visibility of that data, but only if that system allows for it. Yeah. Similarly, if we talk about the private sector, depending on how, for example, in this case, Greenwood wholesalers, how their system is organized, as soon as their clients they update their system, it would reflect in the warehouses in the three cities that Valerie mentioned. Ideally, but I still don't know how that system is organized. But this is how a good information system should be organized, and it should also have an interface for their suppliers so that they can also know at what time they need the supplies back in the country. So it's an integrated system on all sides. One side there is the beneficiary, the other side there's the supplier, and in the center is the operating organization, which in this case is Greenwood Wholesalers. That is a good information system. Now, the key question is, okay, this one is specifically for the private sector, and then we can also ask the same question to our learners in the public sector, that how is information flow organized? What I said, is it something like that, or it is a bit different to what I mentioned? So maybe someone can comment on that, and then after this we move on to our breakout group. Anyone who would like to comment on this question? You can also do it on the chat. Priyanka, in the meantime, if you can create two groups, I will keep on going back and forth in both the groups since
Okay.
Wilson is not here today with us. Okay. I don't see any response to this question. Now let us go to the breakout group. Now let me explain what we are supposed to do. In the Word document that you see on the chat posted by Priyanka and also in your emails, there's a table which talks about data governance, which is it is specifically on flow of information within a supply chain. There are certain questions which talk about how, in an ideal scenario, flow of information should be within a supply chain. So there are some questions which collectively you can answer. The objective here is we will create two groups. In each of the groups, uh, there will be a group leader who, if possible, can share their screen and write the answers of that question as you discuss. You only need to fill one column, which is the first column. The second column is homework. So once for both the groups, the document, whatever is filled in the next 30-35 minutes, we will discuss briefly and it will be shared amongst everyone. Once you receive the document, you can also fill the second column as to how does Zimbabwe's information system compare against the ideal scenario. So today we're going to talk about the ideal scenario, how it should be, rather how it is today. Okay. Are there any questions about this? Priyanka, are you there?
Hello.
Priyanka, if you can stop the breakout room and let everyone come back. Okay, is everyone back from the groups? I'm sorry, I don't think it's going to work. Maybe we can do it directly in a plenary.
I'm back.
Priyanka, is the group stopped? Can you confirm? Because we've lost a few participants by going into the group and coming back. Okay. All right. So whoever is here right now, so this was the discussion that we wanted to have in a group format. But since it seems the group is not possible, as you may not have sharing opportunity, so we can discuss it in a plenary situation directly. So like I said, there are some questions here. So 5, 6 questions about governance of data in supply chains. Okay, sorry, Munamba. Let me explain what is happening again. So we wanted to work in groups. It was not happening since no one was able to share their screen. So I have asked everyone to come back in the plenary so that we can discuss the activity directly here, and I can write directly on the document and send it to everyone after the session is over. Is that okay?
I think it's okay.
Yes, it's okay.
Okay, excellent. So let me start with the first question, and please you can all unmute your mics.
Yes, I also think it's okay.
Okay, excellent. So you can unmute your mics, and whoever
Okay.
wants to speak one by one. So at what level or source data should be collected for any supply chain operation? So all the sources or levels that you think the data should be collected. So you can talk about it, and I will write directly on this document. So at what level supply chain data should be collected?
I think we can start with the service delivery point.
Okay. Any other level where the data should be collected?
At the district,
Okay. When you say district, you mean what kind of like what is the entity or what is the location where at a district you will collect the data? Is it a store? Is it a warehouse? Is it a hospital? What exactly is it?
we usually have district hospitals. So I think at a district hospital, then a provincial hospital and provincial stores as well.
Mm-hmm. Okay. What else? Any other place where data should be collected?
The private sector, they also feed into our service delivery points.
Okay. Okay. You have already gone to what's happening in Zimbabwe. Here I'm asking what should be the ideal scenario. I mean, of course, take the example of Zimbabwe, but any other level where data should be collected? What about the central warehouse? Any data should be collected there?
Yes.
Yes.
Yeah. Okay. So then we see that data should be collected at all levels, but of course the data is different at all levels. That whatever data is being collected at a service delivery point, which is a health facility or a hospital at district and provincial level, we are talking about, for example, a stock on hand. Maybe we are talking about consumption data, that how much is getting consumed. So that is the data that is coming from service delivery points. At stores at a provincial level, they can also collect stocks that they're issuing to the facilities, that is issue data, and they can also talk about stock on hand at their location. At a central warehouse, they can also talk about stock on hand data. They can also talk about issues data to the provincial level stores. They can also talk about lead times. So those kind of data can be collected directly at the central warehouse. Second question is, who should collect the data? Ideally, who should collect the data? At all these levels that you mentioned, who should be the one person who collects the data?
The healthcare worker at the
Okay.
service delivery point.
Okay. Is it a pharmacist or some other kind of healthcare worker?
At the service delivery points, we usually have, especially in our setting, we've got the pharmacy assistants, and we also have the nurses.
Okay. So they are collecting the data. Okay. What about the stores? Who's collecting the data there, or ideally who should collect?
Pharmacy technician.
Okay.
Stores officer or resource controller.
Sorry, which controller? Can you say again?
Stores officer or resource controller.
Oh, stores controller. Okay, okay. Stores controller. I'm only hearing from 2 or 3 people. Rest of them, you are muted. So please, you can also contribute to this discussion. And then we will learn more. We can also talk from a private sector perspective. Who collects data?
We also have
And,
the dispatch assistant.
Okay.
Or
Loyalty
stores
cards.
assistant.
Stores assistant. Okay. Someone else was
at
also speaking,
central
please.
hospitals, we've got the chief pharmacists. They also collect data there. And
Okay.
at provincial level, we've got the provincial pharmacists.
Okay. I'm
And
not
they
sure
also
what.
left out, sorry, the district
Go on, please go on.
pharmacist.
Sorry, which pharmacist?
The district pharmacist.
District pharmacist. Okay.
Yes.
So at all level, pharmacists should be collecting the data. Okay, that's fine. Is there anyone else that you think should be collecting the data?
The dispenser assistant.
Dispensary assistant. Okay.
Yeah.
All right. Okay. All right. If you think of anyone else, do let me know. How should that data be stored? Or for example, how is it stored, that data that you're collecting? How is it stored in Zimbabwe?
Storage. I'm not sure if the health information officers go where we collect data or where we store data.
Okay,
I'm
let
not
me
sure.
ask you this question. Do you have a ELMIS system?
Yes,
Electronic.
we do.
You do. So do you know
Yes.
where all the data that you're collecting, where is there a centralized server or a cloud server, centralized database at federal level, or what level that data is being stored? Does anyone know about that?
So maybe I can say at the SDP, at service delivery point, we can have hard copies of the tools that I used to get the data before we talk of the ELMIS. We've got some tools that are used then to collect data, which are in hard copies. They can be stored at the facilities, which is then transferred maybe for, if it's in the public, it can be transferred to the district offices, maybe in the form of ELMIs. But I'm not sure now whether we have got a centralized server for all the data. But I know that most probably on the desktops of the district pharmacy managers, the information for the district will be there.
But that is not an ideal scenario, no, Lloyd, having data on individuals' laptops or computers, right?
Yeah, it's good ideal.
Yeah. So if there is, sorry, someone wants to say something. Charmaine? Charmaine, were you going to say something? Okay, all right. So if there is an ELMI system, there should be some sort of central database. Now, whether that is a physical server or a cloud server, whether that is centralized or it has different places where it is stored, you can go and check. But ideally, I mean, if you talk about private sector, the way they are doing, there are cloud servers so that that data, once it is reported, it is visible at various levels and even globally. So for example, I believe for Bark Logistics, I don't know if someone is here today, once they report the data, that data may be visible even in other locations outside of Zimbabwe for planning purposes, you know. Now, what do you do with that data? How do you use that data? Do you know about that?
It's usually used for quantification.
Anything else?
For decision making.
Decision making of?
The data can also be used for planning purposes. For example, you can
Yeah, Munamba, it is very
you can be
difficult
able to use it. Hello?
Yeah, it is very difficult to understand what you're saying. Maybe you can write in the chat. It is much easier. Okay, stock management, excellent. Decision making about stock management, inventory control. So this is what you are using the data for. The data you're collecting from all these places, you're using it for stock management, inventory control, and eventually you're also using it for quantification. You're using it for procurement planning. You're using it for supply planning, which is of course part of quantification only. Disease burden analysis. Yes, you can do that. Disease burden analysis, you can do that by comparing your morbidity HMIS data with how products are being dispensed. Sorry, someone else wants to speak. Okay. If anything else comes to mind, please do let me know. Let me go to the last, I think 2 questions are left. One is, how do you check data quality? Adverse effect reporting. Adverse effect, not really, it's not really a supply chain data. I'm really talking about supply chain here. I mean, you can do adverse effect reporting, but that is an entirely different system. And that is an entirely different concept, which is pharmacovigilance. We're not really talking about that. Going back to the question, how do you check data quality?
Maybe by doing some stock verifications. Audits.
Yes. What else? Data quality can be used to physical inspection. Yes, stock verification, physical inspection. Indeed. Any other strategy do you have in any other place? How do you check for data quality? Is there any data quality assessment that happens in the country or in the private sector, where whatever is on the system is mapped against your hard copy documents, then again mapped against the physical or the actual stock. I mean, although that's part of physical inspection, physical verification, but then in data quality assessment, you do even more elaborate analysis. Lloyd, you want to say something?
Yes, so we also do data triangulation, where we say most probably what we've dispensed against what has been issued by the and what they have in their stock on hand. So we do a triangulation of from different sources, so that we see whether the data that has been supplied is of good quality.
Okay, excellent, excellent. So very good points. And I think the last question is, I think we've discussed this already, how to use data or what decisions can be made. So these decisions we've already seen. But one more thing here, actually, what the key answer was for decision making. And then what kind of decisions that we can make are about your stock management, inventory control, forecasting, supply planning, procurement planning. All those decisions can be made using the data that you're collecting. And it also depends how the data is flowing from one level to the other. Someone wants to say something? I hear something. Okay, maybe if you're not speaking now, maybe you can mute yourself. So this is a very basic idea on data governance. Now, again, the word governance keeps on coming again and again. When I talk about governance, and if I link it with anything, that means the what, how, why of that particular topic. So in this case, it was data. So we talked about what kind of data needs to be collected, from where it should be collected, who should collect that, how that data should be stored, and what to do with that data. So that is the entire topic of governance. And we can also add one more layer to this is, but if you're using ELMIS, then it becomes a redundant topic. But still, if it's not an ELMIS, you can also talk about how that data is shared and reported across various levels. Because 5 to 10 years back, the service delivery points used to create hard copy reports. We used to send them to district stores. District stores used to compile them, collate them, prepare their own reports, and then send it to the higher levels at provincial or maybe at central level. This is how data analysis used to happen 10 years back. But now everything is ELMIS. So everything is on your systems, whether on cloud or on other hard drives or on computers. And then all the data can be compiled very quickly at any given level. Okay. So this is what governance looks like. Similarly, for each topic, for flow of product, you can ask some other questions which are related to governance. Same with money, you can ask some questions which are related to governance, and then you can discuss how each of those flows they are managed. Okay. So with this, I think we come to the end of today's session. There are some Q&A. If you have any questions, I can answer. What I'm going to do is I'm going to share with you a refined document, what we discussed, and then you can fill up what is happening in Zimbabwe. And if you've filled that up, please do share it on our emails, info@bskilled, or you can share it with Priyanka, or you can also post it on the WhatsApp group if you're part of the group. Okay. If you have any questions about what we went through today, please, you can ask it. There is an assignment about flow of products, money, and information at the end of this week. Please, attempt that assignment and finish it as in the best way possible, so that eventually you get to learn more about the supply chain system in Zimbabwe as well. If there are no other questions, then Priyanka, if you can launch the feedback poll, and then okay, Shamin, you've raised your hand. please ask your question. And Priyanka, you can still launch the poll. Charmaine, you can ask your question. Charmaine, you are not audible. Maybe you can write in the chat. Okay, no response. Okay, so okay, Faith and Matero, you have a question?
Thank you so much for the lecture. I just wanted to find out, we also have the health information officers. At what point do they collect data as according to the homework that we're doing together?
But at what location
At
these
what
health
level,
information?
yes.
Sorry?
I'm saying at what level do they collect data as health information officers?
So do you know that, or you're asking me that question?
I'm asking.
Okay, you're asking that. Okay, now I'm not very sure about the structure in Zimbabwe. Shaman, I'll come to your question after this. But ideally, if you have health information officers, and the ideal scenario would be for them to collect data from service delivery points, because that will give the overall view of how stocks are being dispensed. And with that data, all kinds of decisions can be made. So if data can be collected from service delivery points like health facilities, primary healthcare, community healthcare, or district hospitals, provincial hospitals, if data is collected from these points, then all other analysis can be made. So if that is what you're trying to ask, I would say the last point where the product is dispensed, collect the data from there. Because you can collect two sets of data from there. You can collect stock data. You can also collect, your HMIS data, like health management, like how many patients came in, how many prescriptions were created, how many prescriptions were fulfilled, which you can compare against the stock data again. Then you can also understand morbidity data like disease prevalence data. You can also understand how many patients were there for any specific disease, and hence compare it against the amount of stock that got utilized for that for the product which is used to treat that disease. So that is the best place to collect it, if I've answered your question.
Thank you. I'm
Yeah.
answered.
Okay, Shamin, the assignment is, you will see if you, when you finish module 2, you will see an assignment where you have to draw the flow of products, money, and information for Zimbabwe. So you will have to draw it on a piece of paper. You can also do it on your computer, on a slide, or on a Word format, or you can use a flip chart, draw it out, click a picture, and submit it. You will find all the instructions at the end of module 2. So if you are on the Hive, you're following the course, by the end of module 2, you will see the assignment. You will also get some tips over there to fulfill the assignment. But that assignment is linked to today's class when I was talking about flow of products, money, and information. So it's the same thing that you have to draw for Zimbabwe. So if you're in a private sector, you can do it from a private sector's perspective. If you're in a public sector, you can draw it out from a public sector perspective. Okay. All right. If there are any other questions, please raise them. Otherwise, we can close the session. The feedback was also very good. Thank you so much. I really appreciate that. And there is one more session next week, after which we will break. The course will remain online. Anyone who wants to carry on with the course online can do that. But after next week's classroom session, the next classroom session will be in January, and those details will be sent to you in January itself. Okay, but you have more time to complete the course, so please you can go on the platform, create your accounts, and start going to the course. You will have a lot more time to finish the course, a lot more time to engage in discussions, and then we can discuss more on the classrooms. Yeah. Okay, so thank you so much. Let's meet next week, and I will keep on checking all the discussions and comments on the course itself. Thanks again, and wish you